Hello students. Today we are going to study the fixed anesthetic. Anesthetics are the drugs which are CNS depressant drugs that produce a partial or total loss of sense of pain accompanied by the loss of consciousness. In that the two categories are there. From the second category fixed anesthetic drugs are there, and first category inhalants and diethyl ether or halothane drugs are used. In fixed anesthetic, this is the second category. Fixed anesthetics are the non-volatile drugs that may be administered parenterally or by the way of alimentary canal. Methotrexate is an ultra-short-acting barbiturate which is administered intravenously as its sodium salt. The presence of NH3 group increases the lipophilic character, hence it produces the rapid onset of anesthesia. Due to the presence of unsaturated carbon at C5 atom, its degradation increases and hence it is metabolized readily in the body. Thus, it helps the quicker recovery and high dose can be administered safely. It is used for induction of anesthesia. The disadvantage is that it has no muscular relaxant property. Hence, for the short surgical procedure, it is implemented with the muscle relaxant. Thiopental sodium is a less potent than methotrexate. Sodium is a thiobarbituric acid derivative. It is metabolized more rapidly than methotrexate. It is used intravenously for the induction of anesthesia, but it is a muscle relaxant. Now we are going to study the structure of the thiopental sodium or thiopentone sodium. Structure involves the main skeleton. It is a pyrimidine. In pyrimidine, where two oxygens are there and another third oxygen, it is replaced with the sulfur group. That's why the name given thio. Pyrimidine, it is a 1,3 position, 2 nitrogens are present in the 6-membered ring. It is called as pyrimidine. 1 and third position, 2 nitrogens are present. It is called as pyrimidine. In that pyrimidine, 2, 4, 6 position, it is having oxygens and sulfur, 2 oxygen groups and another sulfur. And fifth position of the thiopental sodium, it is saturated with ethyl group. It is saturated with ethyl group and 5 pentantyl or 1 methyl butyl group. See, chemical name of this compound is sodium 5-ethyl 4,6-dioxo 5-pentan-2-yl 1H pyrimidine 2-thiolate. Second position thio is there, that's why it is thiolate. 4 and 6 position oxygen is present, that's why it is a 4-dioxo. And fifth position one group is ethyl CH2 CH3, it is ethyl, and one group is 5-pentan-2-yl. Why it is 5-pentan-2-yl? Because for the pentyl or pentane, in the pentane or in pentyl, secondary carbon is attached with the fifth position of this pyrimidine. That's why it is a 5-pentan-2-yl 1H pyrimidine 2-thiolate. Next is the properties of this thiopental sodium. It is a thiobarbituric red derivative in which oxygen group of barbiturate is replaced by thioxo group. The group is readily metabolized in the body, causing the desulfurization. Hence, it is ultra short acting thiobarbiturate. It is 5,5 disubstituted is a branched chain 1-methyl butyl which is oxidized readily. The other is ethyl group. The duration of anesthetic action is 10 to 30 minutes. Thiopental sodium contains its 6% sodium carbonate to prevent its conversion thiopentone to control the atmospheric carbon dioxide. Physical properties of this thiopental sodium. It is yellowish white powder. It has characteristic alaceous odor and has a bitter taste. It is freely soluble in water, practically insoluble in ether. It is hygroscopic. It is free soluble in water because it is in a salt form. It is in a sodium salt form. That's why it is freely soluble in water. Stability and storage. It is a hygroscopic and is decomposed by atmospheric CO2. Hence, it is stored in tightly closed container. Next is uses of this thiopental sodium. It is a very short-acting thiobarbiturate acid. It is an anticonvulsant for induction of general anesthesia for the prevention and treatment of cerebral ischemia. Pharmaceutical formulations are thiopentone injection IP. Dose is 3 to 5 mg per kg per day. By intravenous injection, initially 100 to 500 mg, repeated if necessary after 20 to 30 seconds, and maximum dose is 2 gram. Brand names are pentothal sodium, intraval sodium. Our next drug, it is ketamine hydrochloride. Structure of the ketamine hydrochloride, it is a chlorophenyl. Chlorophenyl which is attached at second position of cyclohexane. See, chemical name is 2,2-chlorophenyl in second position of cyclohexane. Chlorophenyl is there and chloro, it is attached to phenyl group at second position. Phenyl group at second position, that's why it is 2-chlorophenyl and it is attached to the second position. So the 2,2-chlorophenyl 2-methylamino NHCH3 CH3NH, it is a methyl amino 2-methylamino cyclohexane 1-on hydrochloride. Ketamine hydrochloride physical properties are white crystalline powder. Ketamine hydrochloride is water soluble white crystalline powder. Uses are ketamine hydrochloride injection is often used as general anesthetic agent. It can also be used as an inducer of anesthesia before administration of other anesthetic agent. Storage, it is stored in room temperature, controlled room temperature and protected from light. Pharmaceutical formulations of ketamine hydrochlorides are ketamine hydrochloride injection IP, ketamine hydrochloride tablet, ketamine hydrochloride nasal spray, and dose is 1 to 2 mg per kg intravenously. IV, it is intravenously. IM, that is intramuscularly 3 to 5 mg per kg. Brand names are Catler, Ketmax, Ketaminol, Weight, and Anaesthetics. Thank you.